Guys, I hope everybody had a great weekend. I am Dr. Heather Moore, owner of Total Performance Physical Therapy. We're going over band exercises for shoulder pain. So a lot of you have bands around the house, have ordered bands. Lots of people with COVID have created some home gyms, and band exercises and doing them safely seem to be some of the new things that people are asking about. So we're going to go over some easy band exercises. So I have a red band here. Usually the band resistance is usually going in order of the rainbow. So usually like a yellow, like the Roy G. Biv. Yellow is generally right in the middle sometimes. Just understand when you purchase a band, kind of look at their color chart. There's all different makers of bands. I mean, purple in one manufacturer is not the same as purple in another. Red in one manufacturer is not the same as red in the other. So whenever you buy a band, make sure you understand how the resistance is. I usually recommend having a light band, a medium band, and then a heavy band. So that way, if you need to increase the resistance, you can go ahead and do that. But it's really important to understand what the resistances are. Most of the bands you're going to purchase come with a chart, or as you purchase them online, you'll purchase a set and they'll have kind of, you know, light, medium, heavy, extra heavy. So just really understand that, because that can play a big role in either helping that shoulder pain you have or hurting it. So you always want to start off with the lightest band for these exercises, whatever you have. And I recommend purchasing a very light band, especially if you're doing these for shoulder pain. This is going to be strengthening exercises, but this is not for a healthy shoulder. This is going to be for somebody who's got some shoulder pain going on. It's not going to hurt you to do them if you have a healthy shoulder, but these may seem a little bit easier if you're going to the gym, you're working out, you don't really have shoulder pain. These may be a little bit on the easy side. All right, so you're going to take your small band, and it doesn't matter. It can be a loop. It can be, you know, a small piece like this. I'm going to show you kind of how to use. We have a long one here, but we have bands galore here. So we get our pick of what we want to do. What you're going to start with is you're going to start with just some external rotation. So you're going to start elbows by your side, bent to 90 degrees, all right? And you're just going to go and rotate your elbows out, nice and easy, or rotate your hands out. Now, a couple things I want to mention about this exercise. You're not doing this. We are not straightening the elbows as we do this. The elbows are staying bent at 90 degrees. You're going to rotate out nice and slow as far as you can. Be careful if this starts to hurt, then just go to where you feel good and then come back. Now, if you have a longer band and you want to do a little bit more, then you can go out as far as you can until you feel a little bit of pain. You want to stop before you feel that pain. You don't want to continue. You don't want to push through that pain. You want to make sure your wrists stay in neutral. So you don't want to do this, and you certainly don't want to do this. Okay, wrists are in neutral, meaning no bend, no extend, just nice and easy. And you're just going to rotate out. It's important that the elbows stay by the side, that you're not doing this. Okay, this is not one that we want to do. So just like that. All right, and out. Now, depending on the type of shoulder pain you have, I'm going to go over the next one. This is going to just be what we call drawing the sword. So you're going to drop your band, and you want it now. If you have a short band, you can just hold it in this hand. All right. If you have a longer band like I do, you can drop it on the floor. Now, the less slack you put on the band, the harder this is going to be. So what we do is called the sword exercise. So if your arm hurts raising it above your head, you don't want to do this full range of motion. I'm going to show you how to kind of substitute a little bit of it. You want to do this also in front of a mirror, because you don't want to be shrugging your shoulder like this. So you're going to start with your thumb facing you, and then you're going to lift up, and then you're going to stop, okay? The idea is that you're able to lift up all the way over your head and then come back down, rotating your hand. So your thumb starts here, and then you're going to rotate your thumb back and overhead. However, if that is too painful, you're going to just work in that pain-free range of motion. So if this feels good, then that's where you start, okay? Working up a little bit each time, nothing crazy. Again, you really want to watch in the mirror that you're not doing this, okay? You don't want to be moving, only your arm wants to be moving. And a lot of times what happens is, especially as your shoulders weaken because of it not feeling so great, you want to pull up nice and easy, and you might feel fatigue just right here. It's okay if you don't make it all the way up here. Just gently here. You want to do 3 sets of 15 of all of these exercises. We're doing this for endurance. We're not really doing this for strength. So having that just nice and easy as many times as you can. If you can go overhead, great. But the idea is that your thumb starts towards you, comes up, rotates out, and then you rotate it back in, nice and slow. The one thing that I'm going to warn you about the band is that it will absolutely pull you back, and you don't want that, all right? You want to control the motion. All right, so I usually recommend counting on your way down, 1, 2, 3, so you're not just doing this, okay? That's a big no-no. You're causing yourself a lot of pain doing that, all right? So whatever exercise you may be doing, you want to make sure that you are controlling it up and down, and that band is not dictating how fast you're going, okay? So the next one you're going to do is just simply, this one you're going to need a longer band for, or if you have a shorter band, you can just do it 1 arm at a time. You're going to get in the lunge position, and you're going to do a row, all right? That's why I said if you have a healthy shoulder, a lot of you probably do these at the gym with a weight, but when your shoulder's not functioning so well, you want to just pull, and you want to make sure that you're squeezing your shoulder blade together, okay? So you're squeezing that shoulder blade together, and again, you're not pulling up like this. You're almost pushing back and down and squeezing that shoulder blade together. All right, watch yourself in the mirror to make sure you're not shrugging up. And again, this is not a bicep curl. We're not doing this. We're doing a pull back, okay? So kind of just bringing this to your pocket and then putting it back down. As you're doing this, you want to make sure that you're squeezing that shoulder blade together. Just squeeze that shoulder blade together. Super important, again. And then, now, if you want to, and you have a long enough band, you can obviously put both feet together, bend. Now, you don't want to slump like this, okay? Keep your back straight, and then just row, squeeze your shoulder blades together, and nice and easy, just doing that, okay? That's gonna work that back shoulder blade area. Again, if any of these hurt, you wanna just back off. This is kind of a generic shoulder program, not necessarily specific towards any diagnoses, but I know I've been asked a lot of what do I do with these bands? My shoulder's a little sore. What can I do? So these are kind of a little bit more endurance exercises, ones that are not so challenging, but if you have that sore shoulder, they can absolutely help you. If you or someone you know is suffering from shoulder pain and wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898, and we'd be happy to get you in. Thanks, and have a good night.